Let's talk turtles.
Turtles! You know, it all started with a little pin from one of my patients, which is a little jade turtle, for the idea of luck and prosperity that a patient gave to me long ago. And then people would ask me about the turtle, and I would always tell them it was from a patient and it had great meaning to me, but that my husband also had a pet turtle when I met him.
Oh, sure.
And so then all of a sudden everybody started bringing me turtles. And they have great meaning to me because everything that a patient shares with you has meaning not only from what it is, but the fact that they're giving a piece of themselves to you.
Yep.
And they're making that express effort to share with you.
As a geriatric oncologist, what are some of the challenges of treating cancer in elderly patients?
Comorbidities, multiple medications, social issues such as either being isolated from family, lack of transportation, being the primary caregiver for a sick spouse or a sick child or a grandchild in many cases. And what does that mean to their day-to-day activities? I'm really fortunate in that not only am I trained as an oncologist, but I'm also trained as a geriatrician, and you can imagine that in both of those fields we do a lot of end-of-life discussion.
Right.
And then because of that, I realized that it was important for me to get additional training in palliative care. What we want to know is, what are your goals? Because if we understand your goals, we can better treat you and better achieve those goals for you. So sometimes you can have that conversation at the first visit. Depends on how that visit goes.
Right.
Very often I wait for several visits because I want to establish a rapport with the patient and their family. I also want to get an understanding, even indirectly, of what their fears are, what their concerns are, what their hopes are. It may be that they want to make it to their grandchild's graduation. It may be that they're planning an anniversary trip. It may be just that they want to travel to the beach. I think everything that we do as people, humans, providers, speaks to our desire and our willingness to make one's life better or more meaningful. And whether that's simply sitting down with a patient and allowing them to tell their story instead of dealing with what you really wanted to do at the clinic visit, or it's doing something at a grander scale, getting a patient back to their home country when they would have had no means to do that, so that they could be with their family and share their last days with their family. I don't see a lot of difference between the small and the big, because what it is all doing is it's trying to achieve for a patient what is meaningful to them.
Dr. Browner, thank you very much for your time.
No problem, I appreciate it.
That was a CLOSLER look.
All right, thank you.